as director of the National Heart, Lung, and Blood Institute, there can be a tendency, and I'm subject to it as well as a cardiologist, cardiovascular scientist, that those can become somewhat siloed with different groups studying different things. And one of the challenges often is to look at those cross currents, the cross pollination that can happen. And literally, we had clinical trial networks that were for the lung division, separate one for the heart divisions, separate ones for the blood divisions. And one of the things that we did relatively early in this COVID-19 pandemic response was actually to create a new platform using those existing networks, but bringing them all together. We literally called it Connects, such that it was hopefully a little bit more seamless because we're taking care of the same patient. It's just that we're bringing in communities with different sorts of expertise to address the multitude and multiplicity of manifestations of COVID-19, but in a cross-disciplinary way, involving treatment teams, which we as clinicians do on a relatively normal basis, but not always linked to a common platform, common research agenda, common protocols. So that was actually kind of disruptive to the way that the Institute has been doing business for like 70 years as a result of this pandemic. And I think there have actually been some lessons learned about actually the lung and critical care people leaning into the coagulation problem, and the blood people leaning in to work with heart doctors on fixing it. And so I think that's the nature of science in general, is that it's always good to kind of break down those silos, because science, the body, systems often don't respect those little disciplinary backgrounds anyway. And we actually find that doing better science and taking care of patients better involves having that more systematic and integrated view of the world and the body.